Hi, my name is Rhonda Macias, and for this assignment, I'm going to start off by giving you the scenario. Then I will try my best to give details about the symptoms presented and distinguish what the disorder of this patient is suffering from. So the scenario is the Emergency Medical Services EMS team has brought a 54-year-old female patient to the emergency department where I am working. The EMS personnel state that the patient was found wandering in a nearby park by a jogger who called 911 and from her cell phone after the woman screamed obscenities at her and then fell, seriously scraping her arm and face. The woman is bleeding, disoriented, combative, and accusing the EMS team of stealing her purse. Her hands are shaking severely, and she is shouting at the doctors and nurses that she needs a bottle. The woman's clothing is dirty, and you can smell stale body odor and urine. So, based on my first impression of this patient's actions and appearance, I was really indecisive to distinguishing what this patient could be suffering from. There were several diagnoses that came to mind. First, I thought she was suffering of a possible drug addiction, or Parkinson's disease, or possibly schizophrenia. Parkinson's disease is a progressive nervous system disorder that affects movement. Symptoms start gradually, sometimes starting with a barely noticeable tremor in one hand. Tremors are common, but the disorder also commonly causes stiffness or slowing of movement. The reason I thought she was suffering from this disease was mainly because the severe shaking of her hands, which could be classified as a tremor. Along with Parkinson's, hypokinesia refers to decreased bodily movement. She also shows signs of combativeness towards the EMS team. After some further research, I concluded that this patient is suffering from schizophrenia. Schizophrenia is one of the most common psychotic disorders. Almost 1.6% of the population, or about 2 million people in the United States, across all cultural groups, are affected by this disorder during their lifetime. Schizophrenia affects a person's ability to think, feel, behave clearly. Schizophrenia is a serious mental disorder in which people interpret reality abnormally. Schizophrenia may result in some combination of hallucinations, delusions, which would be why this patient is disoriented, and extremely disordered thinking and behavior, which would be the reason for her combativeness and accusing the EMS team of stealing her purse. This disorder also impairs daily functioning and can be disabling. Schizophrenia involves a range of problems with thinking, behavior, or emotions. Symptoms and signs may vary, but usually involve delusions, hallucinations, or disorganized speech and reflect an impaired ability to function. The cause of her hands shaking and the shouting at the doctors and nurses that she needs a bottle would be her impaired ability to function. As for the stale body odor and urine smell, people with chronic schizophrenia, characterized by predominantly disorganized and negative symptoms, have been found to have an unusual specific odor to their sweat, and they have also been found to have impairment detecting these certain odors. Short-term effects would include brief psychotic disorder, where a person experiences psychotic symptoms for a very short period of time. often between 1 day to 1 month. A long-term effect of schizophrenia can cause extreme physical, emotional, and behavioral problems that affect every area of the person's life, included if left untreated. For the assessment needed for this patient, I would include a diagnosis of schizophrenia, which would involve ruling out other mental disorders and determining that symptoms are not due to substance abuse, medication, or a medical condition. Also, a physical exam. This may be done to help rule out other problems that could be causing symptoms and to check for any related complications. Tests and screenings. These tests could include screening for alcohol and drugs. The doctor may also request imaging studies such as an MRI or a CT scan. Another assessment would include a psychiatric evaluation, where a doctor or mental health professional could check mental status by observing appearance and demeanor of this patient and asking about her thoughts, moods, delusions, hallucinations, substance abuse, and potential for violence or suicide. This also includes a discussion of family and personal history to see if there's anyone else related that may have this disorder. For the research question, mental illness management includes both pharmacological and other therapeutic methods for treatment. Treatment depends on the mental illness the patient is suffering from. Mental illness is a complex issue, and successful treatment often incorporates multiple types of treatment. Although psychiatric medications do not cure mental illness, they can help with symptoms. Psychiatric medications can also help make other treatments, such as psychotherapy, more effective. The best medications to treat mental illness will depend on the patient's particular situation and how their body responds to the medication. Psychotherapy involves talking about the condition and related issues with a mental health professional. During psychotherapy, the patient will learn about the condition and their moods, feelings, thoughts, and behaviors. With the insights and knowledge he or she can gain, they can learn coping and stress management skills. Insurance companies have the right to not include or cover any mental illness diagnoses. If your condition is a pre-existing condition, the medical expenses may not be covered by the patient's health insurance. Reviewing your health care coverage or contacting your insurance company is the best way before moving on with any treatment for mental illness. The insurance company can then provide the patient with a list of providers or mental illness disorders that would be covered. Thank you for listening, and I hope you have a great evening.